I'm Wendy Conquest, and welcome to Conversations on Sex, Addiction, and Relationships. I'm here with Dan Drake, Tim Stein, and Jeannie Vitoni. And today we have a guest, Stefanie Carnes. And Stephanie is the president of ITAP, which stands for the International Institute for Trauma and Addiction Professionals. It's the governing organization that basically gives CSATs their training. So they certified sex addiction therapists their training and certification. So Stefanie is also the senior fellow at Meadows Behavioral Healthcare, and she's also written quite a few books. Her first book was Mending a Shattered Heart, which was published in 2011 for partners of sex addicts. And then she wrote, it was a busy year in 2020. She wrote Facing Heartbreak, which is a workbook for partners, and then Courageous Love, which is for couples. And then recently she wrote Facing Addiction, Starting Recovery for Alcohol and Drugs, and that was co-written with Patrick Carnes and John Bailey. So quite a credentialed person we have. She's also a clinical psychologist. And so how are you guys feeling about having Stefanie on today?
I think Stefanie is a talented, very intelligent, wonderful, friendly human. And I think she has so much knowledge to share. And so the topic we're asking her to kind of just focus on today is kink. And that's a topic that I think a lot of people, they really don't know what that means and how far or wide, and does that relate to addiction or not? And Stefanie, having some knowledge in this field, I'm so glad that she's coming to share it
Mhm.
with us. What are you guys' thoughts?
Yeah, I'd say the same thing. And I'm this is a topic I don't think we've even addressed at all on our podcast. So I'm excited to talk about it, I think. And having Stefanie, who has just a warmth about her and a wisdom that she brings, a lot of experience, I think it's gonna be great conversation. So I'm really looking forward to it.
Yeah, and I think this is going to be great. I so much appreciate Stephanie, and I've had plenty of conversations with her about partners and sex addicts and treatment and all that stuff. I love that we are getting to lean into a sexual topic. I mean, like a sexual behavior topic that isn't addiction related per se, but we get to have the conversation with somebody who has that addiction and betrayal trauma lens as well. So we get to talk about, well, what is kink? How does it fit in there? And we also get to talk about it within the context of sex addiction. I'm looking forward to this conversation today.
Yeah. And we also want to just say that if this is triggering for any of our listeners, take care of yourself. You don't have to watch this episode if it's upsetting to you in any way. And for the rest of you, um, you're bound for an education, I believe.
Well,
So,
let me
Stefanie,
say if
oh,
it's upsetting is one thing, and on the other side, if it's triggering.
triggering.
If
Sure.
it's triggering, take care of yourself, turn it off. This may not be the time for you to watch or listen to this episode.
Yeah. Thank you, Tim. Yep. So, on that note, Stefanie, can you join us?
Magic. Ta-da! There she
There she
is.
is.
Hello.
Hello.
Welcome.
Greetings,
Welcome.
everybody.
Good to see you.
Thank you. Thank you for having me.
So I would you say that this is a specialty of yours, Stefanie?
Not particularly. I have done some education on this topic, and mainly the reason why is because it's been a divisive topic in our community. And I've wanted, as somebody who is the president of ITAB, I make a lot of decisions about the curriculum and what goes into the curriculum for CSATs, what they get training on. And this is a very dicey area that does bring up a lot of feelings for people. And we have, it's certainly an area that with sex addiction, these types of behaviors, paraphilias, fetishes, kink behaviors, can be part of that. There is comorbidity with this topic. And so CSATs are often confronted with having to work with it, deal with it. And also when people are developing healthy sexuality later in their recovery, therapists are also giving them guidance around this. And we've had, I would hear things like kink is always, sex positivity. Kink is healthy, it can be healthy. Let's not pathologize sexuality. And then I've heard people on the other end saying it's never healthy. And I think it's very nuanced in that people should understand, what some of the dangers are, some of the concerns are, and also when to take a more sex positive lens. So for me, it isn't really a personal interest of mine particular, but it's more I came to this by wanting to provide some guidance for our therapists about how to approach the issue. And so I think because I've spoken on it before, I think that's probably why you guys asked me to come. So
Well,
we'll talk about this.
how would you, I mean, I'm just imagining the listeners out there hearing kink, and some of
Sure.
them may be very clear, have their own idea about what that is. How would you define, or how would you describe kink, and what falls into like the kink category?
Yeah, that's a great question. So, kink typically falls under what we call paraphilias. So, paraphilias are things like exhibitionism, uh, fetishism, sadomasochism, transvestic fetishism. Those are all different diagnoses in the DSM. You can have a paraphilic interest, or you can have a paraphilic disorder. And in the paraphilias, we typically term about half of them are what we call non-criminal paraphilias, which include sadism, masochism, fetishes, and transvestic fetishism. And typically that is the umbrella of kink. So kink it's basically non-traditional sexual behaviors that can include fetishes and cross-dressing and transvestic fetishism and BDSM, role playing, and it's really in the larger population, it's a culture with a lot of subcultures to it, and there's a lot of different kinds of ways that people practice kink. So it can be everything from erotic hypnosis to rubber and latex to fetishes and things like that. So there's a lot of different types of practices that people engage in, and they often have different subcultures and what have you. And for those of your listeners that are sex addicts can cross over into some of these areas as part of their addiction. And so from our lens of being CSATs working with the population, it's something that is important for us to be aware of and how to treat it.
Can I ask, okay, because I am one of those, as Dan was saying earlier to me, like a bullet point kind of person sometimes when I'm putting concepts together. And so
Sure.
let me just make sure I've got this, that the paraphilias, which is like the overreaching label,
Yep.
which we could also call kink, and underneath that,
Not
no,
quite.
okay,
So the paraphilias are like you have criminal and non-criminal paraphilias.
okay,
So criminal paraphilias, they are voyeurism, exhibitionism, frauderism, and pedophilia.
okay,
The non-criminal paraphilias are fetishes, transvestic fetishism, sadism, and masochism. So
okay,
there's actually 8, and they are diagnoses.
yes,
And you don't get one of these diagnoses unless there is distress, impairment. Usually these things become problematic when they become fixated as a very specific area of the arousal template. So like, for example, if I have a particular fetish and I cannot get aroused without that fetish, and it's interfering with my life with my partner, that's when it typically gets problematic.
and pink would be an overlaying label for the 4 non-criminal,
It's sort of the label that the general population would use,
for
right?
the non-criminal.
For the non-criminal paraphilias, right?
Okay.
Yeah.
Thank you. Good.
Stephanie, can you define fetish? What is that? What
Yeah, so fetishes are specific erotic interests, like a particular arousal templates. And so these are like very commonly with pornography addicts, they will go online, and in an escalating porn addiction, you can see many different genres of pornography. So a lot of these will appear for people struggling with pornography addiction, where they may get focused in one area of a particular fetish. So, like, yeah, I'll just give some examples. Like financial domination is an example of a fetish. Costume play, cosplay, is another one. Erotic hypnosis, as I mentioned before, is another one. Um, Adult baby diaper lovers, that kind of thing. So just like particular areas of erotic interest that people can get very focused on. And again, from a sexual health standpoint, this doesn't, just because somebody has an interest, it doesn't necessarily mean that it's pathological or problematic for them.
That's what
Um,
I was going to ask you, because I think, and that's probably why you wanted to talk about this, because our field, it's such a, and I can imagine betrayed partners trying to understand what does this mean, and how does this, the expression of this. But I'm wondering that intersection, the healthy sexuality, the non-pathological side versus addictive, because we get critique as CSATs from, let's say, from sex therapists who might say, oh, we're just pathologizing behaviors that
right.
are not problematic, and we're bringing shame where it shouldn't be there, or those kinds of things. So I guess, and you mentioned it before, but how do we differentiate, what's addictive, potentially problematic, versus
Yeah.
what's a healthy sexual expression for somebody? Because that's such a loaded topic.
Absolutely. And one thing to understand about that is your typical therapist in the general population, and many of your sex therapists are not working with sex addicts that have really gotten out of control with their behavior. And they have to, like for me in the inpatient world, where I work with people that are in residential treatment, the people that I work with typically have destroyed their lives with their behavior, right? And so, oftentimes CSATs see people that where their behavior is very unmanageable. But in the general population, many therapists uh, generally might be seeing some people that are doing some erotic role playing, or having fun with this, right? And they're not struggling with it. And so we don't necessarily, as therapists, we have to be careful about when people come to us, making them feel judged or stigmatized, right? Because nobody wants to feel that way. And we have to be, and when giving them guidance, we have to be careful about interjecting our own biases around some of these things. Um, and at the same time, there are times that you can get very out of control, and some of these behaviors can be dangerous and destructive, right? And so there's a balance there that a therapist has to understand, and they have to really understand some of the nuances of these behaviors, and when to guide different clients in different directions, if that makes sense.
I'm thinking of the question that did make sense. Let me tell you, it did make sense to me.
Thank you, Jeannie.
I'm thinking of folks who may be listening, and a question I get often here, which is, if we know that someone is struggling with sex addiction, and some of their behavior involves one of these categories, a fetish, BDSM, whatever's, how can you tell the difference, or what would you look for, as one could be an escalation of the addiction, or
Absolutely.
part of one's sexual arousal template?
Right. Absolutely.
Like, how
Or
do you,
both.
or both, or both.
Yeah,
And
right,
so
right.
how does a person, whether client or provider, discern the difference? Because folks are out there trying to learn, trying to understand, and they're like, which camp am I in, or do I have things in both buckets?
Right. It's such a great question, Jenny, because a lot of times when people in sex addiction, people's behavior starts to escalate. And they start getting into things that they never thought that they would ever engage in. And they're just going for the more next and more intense thing, the more novel thing. And this is especially true in porn addiction, because with porn addiction, it's just a lot of it is about novelty and getting the next dopamine hit and just going for the next thing. And it's escalating. And a lot of porn addicts, particular, can escalate into genres that are way outside of their arousal templates. And it's just part of part of being in that preoccupied, ritualized state, addictive state that escalation is occurring in. So when it's part of the arousal template, it's a core feature of something that they are aroused by or attracted to, something that is really a core element. And a lot of times it will be something that continues to be revisited. It tends to be a central focus. And so it's not typically something that they're just, perusing, right? It's something that they're continuing to come back to, right?
Mm-hmm. Okay.
And with fetishes, typically it's a particular, we're talking about a specific interest or erotic interest that has gotten pretty focused.
I have some thoughts. I have some questions, but I was a little bit of a change of gears, if that's okay.
Sure, go ahead.
Is that okay? I'm just thinking of those that are in relationships, because it's your sexual expression, and you're working with your own recovery team on things, and if that's figuring out what's healthy for you, what's not. That's not always the case. I mean, some people might very well be partnered, and they might have betrayal in their story. If they're sex addicts, potentially they have, there's a betrayed partner. I mean, I'm just as you're talking, I was thinking of some scenarios where there's let's say they're ready to re-engage healthy sexuality, and they're maybe doing sexual reintegration of some kind, and they're trying to, how do we bring in desires and interests and fantasies into our sexual relationship? Potentially, maybe they're in that space. This is where it gets a little tricky, because I mean, I can think of some situations where, I've worked on with the addict, the recovering addict, and they've had part of what their template was, or their fetish was specific. And I know for a fact their partner would not be at all interested in that. That's outside of what the partner would feel comfortable with. So there's this zone now, and I guess where it's a different kind of conversation about when someone's in a relationship, and how do we have healthy sexual expression and sexuality with full consent of the other person, and how does that interplay work out? I don't know if there's a question in there, but it's a topic.
No, it absolutely is. And it's something that has to be really discussed in couples therapy and during the sexual reintegration process, because if it was part of the addictive behaviors, right, then it can be very triggering for the partner, right? That then it's every time they bring it up or want to engage in that, it can be a PTSD trigger if it's part of their addiction. So it's really important, I think, to honor the partner's wishes around this when working on reintegration and talking about healthy sex. I mean, we do want them to be able to explore, fantasies and enjoyment and eroticism between them as a couple. But we also have to honor the fact that betrayal trauma may be on board. Also, when an addict gets into recovery, I'm thinking about a couple that I worked with. For example, I had a partner that had some of those interests, and it was very triggering for the addict. Well, the partner wanted to engage in some of this, and the addict didn't want to go there because he was afraid for his recovery, right? And so it's important. I feel it's very important that a partner understands an addict's sexual health plan and has a good overview, of the different behaviors, so that they can be empowered with the truth about all of that, and that there's really good communication about arousal templates and what's triggering and what is the vision for healthy sex as a couple, right? And how that's going to play out. And I think it's a very important discussion for couples to have.
With sex addiction, we often talk about trauma and the underlying trauma and how it influences the way that the addiction is usually expressed. Is there a pattern with kink? And I don't want to stigmatize
Great
kink. Is there a
question.
pattern with kink where kink has a connection to underlying trauma?
It's a great question. So one thing I would say is that we don't want to make assumptions that just because somebody has an interest in that area, that they're automatically have more trauma, more psychopathology, more attachment issues, because the research doesn't bear that out. They're very similar to the general population from that standpoint. That being said, um, can you have scenarios where trauma has influenced the arousal template and that this can be part of a trauma repetition pattern for somebody? Absolutely. And can it be toxic for them in that sense? Absolutely. So I've had, I'm thinking of a couple other clients, like had a female sex and love addict that was abused by her father. And in her kink practices, she was reenacting this abuse. Now, she was not using any safe words, any boundaries, anything it was very high risk behavior for her, very dangerous behavior, and it really reenacted her trauma history. Um, and so in a situation like that, that's a red flag, right? That's a big red flag. And it isn't, again, back to Dan's point, it is important to bring that into the discussion of the coupleship, so that like that male partner in that situation has an understanding of the trauma history, and that there's some sensitivity and also understanding where that came from for that partner. So it can be absolutely, but we don't want to blanketly assume that that's the case for everybody, right? And that's a mistake that I think therapists can make sometimes, is just taking an assumption, oh, there must be something wrong with this person because they're into this, right? And I don't think that's the case for everybody. And at the same time, it's important to get all that history and find all that out, because it can be.
In sex addiction, one of the things that we're always trying to screen out is the moral discomfort. Is this an addiction pattern, or is this something that, from your moral perspective, you're uncomfortable with? And not identifying sexual behavior that just somehow doesn't match with you with being an addiction. Is there a similar pattern that we see with kink where people feel like it's more problematic because somehow it doesn't match what they feel like they should desire?
Sure, absolutely. You can have like moral incongruence in this area. As a matter of fact, there are people in the field that don't feel like the non-criminal paraphilias should be diagnoses at all. They feel that that actually pathologizes this behavior, and that it's actually quite common. People don't realize that, like that about, like, for example, about 10% of the population has participated in kink activities, and about 1 to 2% have a kink identity, right? And about, over half have had fantasies in this area. So it's actually quite a common set of, as we're talking about these templates that we're talking about. And so, it can be a very common arousal template. So we don't want to necessarily presume that it's pathological, as we were talking about.
Thinking about that moral incongruence, whether it's part of an escalation, part of trauma, or part of just who we are, I can hear the moral incongruence for someone whether they or their partner are very uncomfortable with that.
Absolutely.
And so if someone wants to not do that behavior, or in the relationship agreement, we're not going to do that behavior, I've heard fear of, well, then what do? I don't want to do the behavior I have shame about, but can I be aroused in the same way? Can I have sex in a way that is still really enjoyable and meaningful to me?
Right.
Have you heard any of that? And what?
Absolutely. And sometimes there's not super easy answers to some of that. Sometimes a couple has to work together and sometimes expand expand their sexuality in different ways. What ways can we be more sensual and develop our healthy sexualities? And explore different areas that perhaps that they are both comfortable with, that they can expand their repertoire, so to speak, to keep things spicy and enjoyable, right? We want people to be happy and excited about their sexuality. And sometimes you have couples where the arousal templates are kind of fundamentally different, and it can be hard to reconcile that. And that can be an negotiation and a process of discussion and talking about that is harder in some situations and easier in others.
Mhm.
Well,
I'm sorry.
go ahead,
So,
Wendy.
quick. So, I'm thinking of some of the couples, and um, this topic can be so sensitive to talk about. And so, is there any kind of like checklist or assessment, or that you can give to each person to say, okay, here are all the different types of ways to be sexual, and what do you think about each of them, or have you thought about any of them, or have you fantasized about any, just to kind of like get that out in the open?
Yeah. Um, I'm sure that there is, Wendy. I'm sure that there is. I don't have one offhand in particular. But in the back of the book, Sexual Anorexia, I don't know if your readers are familiar with that book at all, but um, the Pat he developed the 12 dimensions of healthy sexuality, which can be interesting to look at. Like he talked about things like how can you develop your sensuality and your intimacy and in other ways. So things like maybe taking a bath together, or erotic massage, or foot massages, or things like that. You can look in those 12 categories and say something like, okay, well, how can we increase our sensuality together, right? And how can I'm sorry, I can't remember more of the categories right offhand in this moment, but it talks about healthy sexuality a lot. Another great resource in this area is Bill and Ginger Burkaw's book. I don't know if you're familiar with that, The Couple's Guide to Intimacy, that has some different exercises to develop intimacy. And another one is Alex Katahakis's book, Erotic Intelligence, which is another great resource that has some suggestions. It's the subtitle, Developing Healthy Sex After Sex Addiction Recovery, right? Oh, there we go. And her Sexual Reflections workbook, right? So I think there are some great resources out there to look at that for couples.
It sounds so beautiful to be able to talk about this and share and open, but I know many people that come to me, they barely talk about the highest level of sexuality, even level of maybe interest in being sexual at all, let alone their kind of deeper desires or fantasies. So I mean, I think those resources are really helpful. You mentioned couples therapy. I think that's really helpful for people to have. I mean, doing this alone, couples can do it, but there's so much that comes with this, and so much history, and potentially, we talk about moral backgrounds that people have. So I just an encouragement to do this with guidance, because I think this is a really difficult area for so many people, because it stirs up so much. So I mean, right.
And also a lot of times we focus so much on the addict's sexuality and what's going on with them. And then we never turn around and look at what's going on with the partner and their feelings about, the different acting out behaviors, how it triggers them, their arousal template, and the couple, how, their history together. So I think that's a very important conversation to have.
Yeah. And Dan, I was thinking when you were talking, how risky it is for somebody to say, hey, I kind of had this thought, or, and then the other person goes, oh my gosh, how could you ever think that? Or, to be dismissive or shaming around it. And they're like, okay, I'm shutting down now, never mind.
Right.
And then the conversation ends. So, yeah, to have some of these resources and to lean into, a couples therapist. I don't know if there's couples coaches out there. I know there's betrayed partners coaches. Jeannie's nodding her head, yeah. But to get some help to navigate these conversations.
Especially if betrayal's in the mix, betrayal trauma to add to it all, it becomes obviously really difficult to navigate these waters.
Right.
I wanted to say one thing and then ask you a question, Steph. The one thing I want to say is I hope that everyone is hearing that Stefanie is really advocating, as we all are, I'm sure, to talk about these things and the importance of that communication and because we may talk about the behavior and lots of people will focus at the behavior and go, I'm not ready for that. No one is saying go do that. No, what we're encouraging is the discussion of, and we have a saying, Tim and I, is sex starts in the kitchen. When y'all are sitting down at the kitchen table and you're discussing things, like it's the sharing and exploring. Stefanie, my question for you was actually going back to the beginning to the kink category, the non-criminal. Can you give a little bit of definition of what each of those are? Because we might be very fluent in some of those terms, but a lot of folks aren't.
Sure. So some of your listeners might be familiar with the term BDSM, or bondage, sadism, masochism, and discipline, right? And so that typically involves pain exchange of some form, right? So sadism, which is one of the categories, is the delivery of pain. Masochism is receiving pain. And fetishes, that's the second category, encompasses many different types of behaviors, many different erotic interests, as we were talking about before. Transvestic fetishism is dressing with as the other gender, usually for some sexual gratification. So this is different from like gender dysphoria, for example, where you maybe think that where your gender identity is the opposite gender. Usually this is more of a kind of in a sexual nature that this is occurring. Yeah, so I think that did I cover them all? I think so.
Well,
Well,
you were talking about some of the ones that are criminal, but you mentioned frauderism. I'm not sure everyone's familiar with.
Yeah, that's one of the criminal ones. So that is when you go up and touch somebody and pretend it was an accident, kind of that kind of intrusive sexuality where you're invading people's space. Yeah.
So so what caught my ear, Stefanie, was wearing clothes that typically are with a different gender. And so, I mean, I've had clients to do that, but it wasn't sexualized.
Yeah.
But maybe I'm kidding myself.
No, it can be. It can be not sexualized. Absolutely.
Okay.
It can be like just, kind of cross-dressing without a sexual component. It can be either, but it often has a sexual component.
And so to be a fetish, is it either like you're cross-dressing with a sexual intent or without a sexual intent? Is it still considered a fetish?
So it's yes, it's a fetish, but it's not necessarily problematic again.
Got it.
Right? So some people enjoy that and there's no problem with it, right? What they do in the privacy of their home, they like to wear, the other gender's underwear or lingerie, what have you. And it's not necessarily a problem unless they're distressed by it, right? And oftentimes it may be shame, right? That they just are so ashamed, they have the values incongruence again, or it's a problem in the relationship and it's creating a lot of relationship problems, right? And so that's when it usually becomes problematic. And so it can also be problematic when it becomes fixated. So when it's fixated, it's like, I can't get aroused without this.
Mhm.
And then it kind of limits what the person can engage in from a healthy sexuality perspective.
Mhm.
Can I ask you, and I appreciate that, Stephanie. I appreciate all you're bringing. You mentioned earlier, you talked about a client that had the red flags because they didn't have boundaries or safe words. Can you just talk about the intersection of safety with some of the kink practices
Yeah,
and how
absolutely.
people can make sure that they're safe?
There is a lot of things that we as clinicians need to look out for here, and that I think your clients would too. So, um, first of all, intimate partner violence, right? This kind of thing can be uh, intimate partner violence can be couched as kink, right? So if there are dynamics like um, coercion, people walking on eggshells. It's not really consensual. There's excuses, and then there's a honeymoon phase. There's kind of that cycle of violence, power and control dynamics. Um, eroticized rage. Maybe somebody's getting their anger out on somebody. Those are big red flags, right? So any exploitation or coercion, also high risk behaviors when it's starting where the risk is increasing. Usually in kink communities, when they talk about safe, sane, consensual kink, they also talk about what's called risk-aware kink, that if you're going to practice kink, you practice it with somebody that you trust. And as things are more risky, you're more attentive to, what are the limits here? Let's communicate well about this, debriefing about it, setting it up. So there's a lot of care given to orchestrating things. And sometimes, that's not happening for people. And so it can be, or substances are being used that make it, a more out of control. So if there's a lack of boundaries, a lack of safety, if it becomes injurious, I think, I've had clients that have unfortunately been deeply injured by behaviors, hospitalized because of behaviors. And so there are some kink genres that cross over into behaviors that can be actually injurious to people. And that is a big red flag. And then I would also include deception, involved deception to your partner. This is, engaging in this kind of behavior requires a lot of open communication and honesty. And if you're deceiving people and deception is involved, for me, that's a big red flag. Um, and then also another one that's I think really important and a lot of people don't know about is breath play, what's called breath play. And that is actually quite dangerous. And people, when there's choking of some sort involved, a lot of people don't realize that there are a lot of like very fragile membranes in your throat, and people are, accidentally killed that way. Right, not that unfortunately happens too frequently in our country. So things like that would be, things that we would really want to pay attention to, right?
So the what comes up for me as you're talking about that is like in sex addiction, one of the things we talk about is so painful, especially for partners, is the secrecy. It might be okay, well, they were looking at porn or they were doing with this other behavior, but that they kept it a secret from me is so painful. And I make up that while not every obviously not every kink behavior is addiction and not everybody who engages
Yeah.
in that is an addict, but there's a equally important piece of, if you're engaging in a sexual behavior, that your partner's aware that that's on the table, and they may or may not choose to engage in it with you, but that you're not keeping it a secret from them, that that's something that you enjoy or you engage in.
Right, absolutely. I think that they have a right to be informed of that, right?
Yeah.
They should be that information. Otherwise, it's a violation,
Yeah.
right? In many
As
cases.
we're wrapping up here, any last thoughts on kinks and anything you want to leave us with, or anything you want to make sure that we're aware of as we're sort of thinking about kink in the context of betrayal, trauma, and sex addiction?
Yeah, no, I just think that if you have, I mean, naturally, if they have questions about this, as Dan was talking about earlier, it's best to talk about this with your therapist. A lot of people don't bring this kind of thing up because they feel they're embarrassed by it, they feel ashamed about it, and they feel like they're afraid to talk about it, essentially. So I just would encourage people to bring it up there. We hear about this kind of thing a lot, right? Especially working in this field. So I would just encourage people to reach out and get help and help get some support navigating this for both parties, addict and partner, and as a couple.
Great.
Well, thank you so much, Stefanie. What a great conversation. We really enjoy you being here and stretching us a little bit out of our comfort zone of the topics that we typically cover. This is great.
Yeah, well, thanks for having me.
Thank you.
And for all of you out there listening to us, thank you so much for joining this conversation with us today. Please rate us on whatever platform you found us. And if you have questions you would like us to answer, send those to us at conversations.sar@gmail.com.
Thank you, Stephanie.
Yeah,
You're welcome.
Thanks, Stephanie.